You're watching City Channel 4, your window to our community.
Karla Earnest. I'm the nurse manager at Mercy Home Health Care. I'm here because first we are part of a caregiving organization, Mercy Hospital and Mercy Home Health Care, and I have a lot of personal experience with being a caregiver. So professional and personal experience and interest in this. And this is Traci Burton, who's the medical social worker at Mercy Home Health Care, who has a wealth of information and knowledge about resources and ways to help caregivers and help the caregivers take care of themselves. So with that, I'm going to turn it over to Traci, and she'll start and go ahead.
Sounds good. So like she said, my name is Traci Burton. So basically what we're going to go over today is community resources for caregivers. I know that along the spectrum of caregiving that people can often get overwhelmed, and looking for resources ahead of time, during, and even towards the end of the caregiving cycle is always important. So we're going to go over some options that you have. First of all, I want to talk about caregiver rights. It's really important for you to remember that as a caregiver, it's two things. It's both a choice and a commitment. Caregiving is a big choice to make in your life, and it's also a very big commitment to make. So when you become a caregiver, there's a lot of things that you need to think about in terms of if you're ready to take on the challenge, if you feel like you have the support network to be a good caregiver, and realize that there's going to be a lot of flexibility within the caregiving cycle. But it's also very important to honor yourself, and to do that you have to realize that there are 4 rights. You do come as an important part of the caregiving relationship, and you need to remind yourself sometimes daily that you do have the right to take care of yourself. You can't take care of others if you don't take care of yourself. You do have the right to say no. You don't have to take on everything all by yourself. Constantly saying yes will lead to being overwhelmed. You have the right to ask for help. It's very important that you do ask for help, and when people offer help, to accept the help that they're trying to give you. And you have the right to express how you feel. Talking about your feelings all along the caregiving cycle is very important. So we're going to go over some things that you can do to take care of yourself. So these are all pretty familiar tactics to take care of yourself. But in terms of taking care of yourself physically, always get a good night's sleep. It can be difficult when you're stressed out and overwhelmed, but studies have shown that lack of sleep chronically is the #1 reason that people become overwhelmed and begin to lose function. If you're not able to sleep well, you can't function on a daily basis, let alone taking on a caregiving role. Making exercise a priority. This can be as simple as walking around the block once a day. It can be doing 10 jumping jacks in the morning. It can be doing some easy yoga. Just taking 10, 20, 30 minutes out every day just to have some time to focus on exercise is really important. Eating healthy foods, we all know this. Having a balanced meal that's low in saturated fats and low in sodium content will definitely help you maintain a physical well-being that helps kind of in the overwhelm or in the overarching area of being a caregiver. If you don't feel well, how can you take care of somebody else? And also it'll help you from like getting sick more often and things. Getting a regular health checkup is always important. Having a flu shot, and avoiding alcohol and drugs. I know that when people become overwhelmed and stressed out in life in general, it can be very easy to turn to substances that kind of feel like they might help you out in the meantime, but in the end what happens is that you begin to lose the ability to take care of yourself as well as anybody else. So staying away from substances is very helpful, and some would say caffeine as well, but I'm not going to. Mental health. So sometimes taking care of ourselves physically is kind of easier because it's an active role. You can kind of, it's the doing part of it. Mental health is a little bit different. It's really important that you find somebody ahead of time that you can talk to, whether that's a friend, a neighbor, a family member, a counselor, another person who's a caregiver. Reach out. Find somebody that you can talk to openly, so you don't feel like you're holding things in, and also so you're not feeling like you're burdening. For example, say you don't have anybody to talk to and you kind of feel it's been building up and you want to talk, but all you have is your sister, who is very sensitive to the topic because you're caregiving for your father. It might be a trigger point. So you want to find somebody who you can talk to, that you can talk to openly without feeling like you're going to hurt anyone's feelings. Taking a break every day is important. You can do this during your exercise period. You can do it separately. Sitting outside for 5-10 minutes and just not doing anything is extremely important. Like I said before, asking for and accepting help. For some reason, this can be the most difficult part. I think in caregiving, a lot of people, they want to do everything for their loved ones. It's kind of in our nature, I believe, to take over and kind of just coordinate everything on our own. When you ask for help, it's important that you realize that you can ask for very small things. You can delegate very small tasks. Could you please, for example, pick up groceries once a week? That's it. And accept help when people are saying, what can I do? Ahead of time, if you can start to list out things that might be helpful and take the burden off of you, you can say, yes, I absolutely need you to run and grab my father's mail from the post office every week. Just very simple, detailed tasks can take off the load a little bit. If you are feeling like you're getting a lot of requests to do a bunch of tasks, it's okay to say no. It's hard to say no. I think that in the cycle of trying to do everything on our own and handle everything, saying no, you kind of start to feel like a failure, or you're not picking up the pieces, but it's really okay. And forgive yourself. As it says, no one is perfect. Everyone, all caregivers, all people, get frustrated, even resentful at times. Recognize how you're feeling, focus on it, and then move on. You don't have to dwell on it. You don't have to feel bad about yourself. Take note. Maybe make a small change to avoid making mistakes that you've done that might be making you feel frustrated, and move on. Social health. So it's important for us to not feel isolated when we're caregiving. Make sure that you stay in touch with your friends and family that you were in touch with before the caregiving began, if that's possible. And if that's, if you've been caregiving for someone's entire life, just focus on really connecting to loved ones in a social manner on a regular basis. So like that says, it can be by phone, by Skype, or even just having a cup of coffee once a week. Definitely make time to do something you enjoy, something that's kind of all yours. This can be a little bit of anything. It can be from reading a book to going shopping to taking a nap. I guess whatever you like to do. If you like to do laundry and that makes you happy, do laundry. And then try to plan an outing or a short trip with a friend or relative at least once a month. This is a very difficult part because, as we'll talk about later, it tends to require respite care, so that somebody's taking care of your loved one in your absence, and we'll go over that later. But if you do plan ahead, you can make it more of a priority to have these outings and have someone that you trust taking care of your loved one. And, taking charge of your life. Taking care of yourself. It's not selfish, it's important. And also spiritual health. So whatever faith you may be involved in, stay connected to it. A lot of people find that meditation and prayer are comforting, and it does relax you, and it definitely slows down the day a little bit. And finding meaning in your life, in your role as a caregiver, has been shown to be very meaningful for people. Okay, so we're going to go over a little bit about stress versus burnout. caregiver stress tends to come first. So we're going to go over the signs and symptoms and kind of try to think about if you've ever experienced these things, if you've experienced these things often, just kind of think about your own journey as a caregiver. So one of the symptoms is anxiety, depression, irritability. People tend to feel tired and run down, not able to gather as much energy as they had before. Difficulty sleeping is very common. As I mentioned before, getting a good night's sleep is really important. Difficulty sleeping is one of the first things that people tend to deal with. And overreacting to minor nuances, so things that might not have bothered you earlier, noises, clutter, whatever, didn't trigger you before, might suddenly become part of the package that feels like things are kind of starting to crash down around you. If you start to notice any new or worsening health problems, it could be a symptom that you're becoming chronically stressed. If you're having trouble concentrating. If you're starting to have feelings of resentment. I mentioned before that everybody feels resentment at some time. If you begin to notice that it is becoming a pattern, it's something to take note of, to notice that you're becoming more stressed. If you turn to drinking alcohol, smoking cigarettes, or even eating more, or any other kind of behaviors that can negatively impact your life if you do it more than you ought to. If you start having an inability to take care of your daily responsibilities, I think when people become stressed out, they start to weed out the little things that could probably wait. If you notice that, certain responsibilities that shouldn't wait are becoming neglected, paying bills, taking care of the pets, your own home and family, stress is starting to play starting to have an impact on you. And if you are starting to neglect yourself by cutting back on leisure activities, that's another symptom. So if someone is feeling stressed out, like any of these things chronically, and don't really take time to kind of take note on how they're doing and what they can do to change the feelings that they're having, it can lead to burnout. Caregiver burnout is kind of at the end of the spectrum in terms of when you're having everyone has a tough time as a caregiver, but if you get to the point where you are unable to properly care for yourself and your loved one, you may be leading to burnout. And I'll just go over some of the symptoms of burnout. So you've had much less energy than you had. So are you starting to sleep a lot more at night? Are you needing to nap 2 times a day? Are you getting sick a lot? Your immune system may be starting to feel the effects of caregiver burnout. People tend to catch colds or, feel foggy, even getting the flu, just getting sick more often. If you're constantly exhausted, so sleeping doesn't refresh you, you may be experiencing burnout. If you are chronically neglecting your own needs, you just don't feel like you are there to take care of yourself and it's not a priority in your life anymore, that would definitely be a concern, and I would say not only just burnout, but leading to depression as well. So if your whole life has become kind of part of being a caregiver, in other words, if you don't have other aspects to your life aside from caregiving, and you don't like it anymore, you're constantly resentful, you wish you didn't have to do it, any of those things, you're burnt out. And so on top of that, you'll have trouble relaxing even when help is available. A lot of times when someone is burned out and then they reach out for help, it's too late. And you might notice that you're increasingly impatient and irritable with the person that you're caring for. And helplessness and hopelessness. Okay, so in order to avoid burnout, that's the major thing we want to do, so you don't get to that point, is you can take advantage of community services. There are caregiver services in your community. There is a plethora of caregiver services in our community. it listed a bunch of them. So in Iowa City, the Iowa City Senior Center is an amazing resource for seniors and people who aren't 50 and over, for example. They have, I don't know if you're familiar with it, but they have a wealth of classes, workshops, seminars, and it's a great social outlet. The Johnson County Department of Human Services is a good resource that you can turn to ask for further information, or if you have a specific need, they can point you in the right direction. And in Kirkwood, in Cedar Rapids, runs the Heritage Area on Aging. They are an amazing resource and can also help you with concrete services as well as further referral. Caregiver support for veterans. If any of you are caring for a loved one who is a veteran, the VA hospital is amazing. The Iowa City VA has a caregiver support program that is incredible in terms of the services that they offer for the caregiver. This support group has respite care. I believe there's a certain number of hours that comes for free with each veteran's benefits. They can help you with getting health care coverage figured out, financial support. They will even help you if you decide when it's time to find a nursing home, for example, or adult daycare. They can help you locate that. So affiliations, if your loved one happens to be in like fraternal organizations such as the Elks, the Moose Lodges, they can also be a resource for you. And I know affiliations like that often have financial support. So if your family member is a loved one, it's possible that they can help you financially with some services that you might need. Transportation services are a good way to kind of ease your burden. There are several transportation services in Iowa City that can help you if you need to take your loved one, for example, just on an outing to do errands, if you need to transport them even to adult daycare for the day and back, that's an option. And it does say adult daycare. Adult daycare is basically what it says. It's a place that you can take your loved one to spend the day in a safe, controlled environment. And an example of that in Iowa City is Pathways. They have an amazing program that offers many different programs. So if they want to play cards or join a reading group or sit in the garden. Adult daycare can be very beneficial for not just you as a caregiver, but also for your loved one. So we've been talking a little bit about respite care. So respite care, does anybody here use respite care right now? No? Does anybody know what it is? It's a temporary break for the caregiver. Where they leave their loved one in the care of a skilled, trusted, either person or affiliation for periods as long as a couple hours, an entire day, sometimes up to a week long. So respite care is designed to give the caregiver a break. This is incredibly important as a caregiver. You absolutely have to take a break to take care of your own needs as a person, to take care of your own family needs, to take care of your own household, and just to simply get away. It provides relief from stress for both the caregiver and your loved one. Sometimes I think when people are in need of a caregiver, like a full-time caregiver, it's often true that they might feel guilt or they might feel like a burden. Being able to avoid the negative tension that might develop from not using respite care can help strengthen the relationship, the caregiving relationship. Respite care, like I said, has flexible hours. Different agencies will offer, say, from Monday to Friday, 8 to 5, for example. Some are 24/7. Some are only for, weekend care. Each agency is different. And financial assistance is often available there, again, depending on the agency, but it is often possible to find sliding fee scales, to access a waiver to pay for your services, to use some insurance, and of course private pay is always available. And for veterans, like I mentioned before, they have a certain number of hours that they can get every year for free. And the effect on the primary caregiving relationship, like I said before, it actually strengthens it. Both parties tend to feel like they're in a collaborative role, rather than one person necessarily calling all the shots and becoming stressed out and overwhelmed, while the other person just has to do what they say, for example. So respite care providers, in a typical day, for example, here are some options that a respite care provider can offer. So helping with meal preparation, just providing companionship, just hanging out, helping your loved one to take medication, helping with light housekeeping and any kind of simple tasks, so that while you're away, you don't come back to a mountain of duties that you now have to face because you've been gone. And the hourly rates are determined, by the agency, by the family, by whatever insurance you may carry. This is on your PowerPoint printout. So these are the area respite care providers, the agencies that can provide some are in-home and some are adult daycare. Pathways is adult daycare. The other locations can provide in-home care. Other resources, so these are links to resources that you can access on the web. What they are basically are resource and referral agencies. So for example, United 211, I don't know if anyone is familiar with it, but you can contact them and ask them for information on pretty much anything you can think of, and they will help direct you to the agency or individual in your area that can assist you. So whether you're looking for financial assistance, respite care, social outlets, elderly services, help with nursing homes. These are all agencies that can refer you. Iowa Compass is a very interesting one. I gave you guys each a postcard and a magnet. They are a fantastic resource. If you have a computer, you can also call them, but if you have a computer, you can email them at the iowacompass.org and ask them your specific question, and they will, for example, say you're looking for, your loved one needs a wheelchair. You feel like you want to get a wheelchair and you're not sure where to go. You can ask them where would be a good place to purchase a wheelchair. This is my insurance, this is my loved one's diagnosis or condition, and they will come back often within a couple of hours with local agencies and businesses that can help you. So they're very fast, they're very thorough, and they're just an amazing resource to have in your back pocket. So I want to talk a little bit about not relying on solely the community agencies, although that's extremely important to be able to do. Focusing on asking for friends and family and neighbor support. This is really hard for some people because individuals don't want to overwhelm or burden the other part of their support network. So the first thing to do is absolutely speak up. Nobody will know what you need unless you don't tell them. It's okay to communicate with your friends and family and your neighbors what it is that you need help with. Spreading the responsibility, so the more the merrier. The more people you have in your support network that can help you out with big and small tasks, the less chance that any one person will become overwhelmed. So if you have, just one or two people helping you out, that's a great start. It's much better than doing it all yourself. Ideally, you'd want to have a few more, even more if you can get them in. Spreading the responsibility also makes it possible for everyone to do smaller, more concrete tasks rather than kind of having to, for example, some people will say, well, my sister and I will do all the caregiving. I'll take Monday, Wednesday, Friday, and my sister will do Tuesday, Thursday, Saturday, or whatever, and just try to divide it like that. And then whatever happens on those days, they have to take care of everything. Well, what actually works a little better for some people is if they have people that they can rely on that always consistently take care of one or two tasks. If your loved one or yourself has pets, dogs that need to be walked, the teenager that lives next door might very well be willing to walk your dog every single day. That would take off some of your responsibility. So, in other words, not just spreading the responsibility among a number of people, but delegating what they need to do is very helpful. So setting up a regular check-in, this can be great for friends and family members who live far away. If you have people who aren't in the local vicinity, this is a great thing to ask them to do. Have them pick a day and a time, and call. Just call and check on you, call and check on your loved one. If they're able to make the trip, come see us once a month. And then they can not just help, but companionship is also very important for both parties. This is a big one, relinquishing control. So when you get to the point where you're in a caregiving situation, you've been doing everything on your own, you can kind of start to feel like, I've got this under control, and having more people might just make it more messy. It'll be just more work for me to make sure everybody's doing what they're supposed to do. So I'll just handle everything. Well, what happens then is you become overwhelmed eventually, and maybe even lead to burnout. So relinquishing control will help you in the long run. It might feel a little chaotic at first, but it's extremely important, and it also lets other ones know that they're important in the caregiving role. So, did you want to talk a little bit about that?
So as Traci was working on the PowerPoint and putting it together, I was looking it over and trying to decide where it was that I would be most beneficial to add any information, because Traci is so knowledgeable. My personal experience, as I said, is probably the best thing. And when I read on the previous slide about relinquishing control, it really struck a chord for me, because I am very hesitant to relinquish control, especially my household, to anyone or anything. And to give you some background, I cared for my husband who died of cancer. He was a very, very intensely private person, didn't even want a cleaning lady to clean our house when we were well, and he didn't allow anyone in the house, even the cleaning lady, when he was getting sick. So it took a lot of effort on my part to give some control to people for anything, because I tend to be that way, and he was that way even more. So giving control to others for any tasks is incredibly important. Like Traci said, if you can concentrate on something that's concrete, that's finite, that you can say, this is something I want you to do, you can just put it away and not think about it. So giving up control for some of those things is incredibly important. The other thing that I wanted to briefly touch on is as far as taking care of yourself. As I said, my husband was incredibly private, so he did not want a lot of people coming in, which meant I needed to be out occasionally. So until the point that he couldn't be home alone, I did go out, and he was fine, and we had systems in place. One thing we used was Lifeline. So even though I went to work, until the point when he could not leave the house and he couldn't be alone, I knew that if something happened, he had that resource, even though in my mind he was okay alone. Just in case he wasn't, we knew we had that. That's a really good resource. It's low cost. It's something that they can use. Many people have it. It's easy to get. And then even when he got to that point where I needed to be alone, I could leave for a half hour or an hour at a time and know that things were okay, and he could be there with someone I had incredibly helpful family members, a sister who spent weeks with me at the end of my husband's life. Iowa City Hospice was incredibly supportive, and our children were very helpful too. So I especially wanted to reiterate the point that Traci made about relinquishing control. You think you want to be there, and you want to be there all the time. He wanted nobody else but me, but I had to work through in my mind that even though he said that he knew somewhere that I needed to be healthy through this process, and then especially afterwards, because we had lots of conversations about that point too. So that's really my major contribution to this, is making sure that you know you can't do it all and it's okay.
Absolutely. And one of the things that can be very helpful to you as well as a caregiver is to look for a support group. We have great support groups here. I believe the cards are on the front table. I don't know if you guys grabbed one, but the information is also on this slide. It's offered through the Iowa City Hospice and Pathways, as I mentioned before. The caregiver support group can help caregivers make connections with other caregivers, finding someone that they can talk to and connect with who understands. Of course, it offers an emotional and educational support. So, it can be an emotional journey for people to be caregivers, whether they're facing a sudden illness, whether it's been a lifelong journey. Everyone has their own unique experience with being a caregiver. Support groups can help you feel that you're not alone, even though your situation may be very unique to you. So caregiver support in Iowa City is offered the first and third Wednesdays of every month at Johnson County Extension. And free respite care is available for your loved one during that time. The contact information is on the slide, and I believe you have it in your packet if you wanted more information. There's a couple of different types of support groups that you can access. We just kind of talked about the local ones, but there's also online. So some of the benefits of having a local support group are that you get to physically make contact with people and maybe even broaden your support network. Making new friends, they might have information that you hadn't heard about yet, and they can lead you in another direction or offer advice that you hadn't yet heard. It provides a social outlet, so joining a support group gives you the benefit of having 1 to 2 times a month where you have something on your calendar where you're getting out of the house and you're going and meeting with other people. So it's a break for you as well. And the last thing is that a local support group will be filled with people who are familiar with what goes on in the Iowa City area. So, like I said before, they might have more resources that you had never heard of before. Support group members are often a resource in and of themselves. Online support groups are a little different. By its nature, it's all conducted online, but it does give you the benefit of being able to find people who, since you're accessing people from all over the world, you might be able to find people who have not just similar interests and ideas of your own, but also similar stories to your own. There are, thanks to the internet, there are hundreds of places that you can find support groups. They're not hard to find. You can Google it. So for individuals who do have a hard time leaving the house or don't want to wait till the first Wednesday of the month at 1 o'clock, they want to talk to somebody right now, you can access a support group 24/7 from the comfort of your own home. And rare situations make it easier for people who do have very unique stories or experiences. It does make it a little bit easier for you to find somebody who may have some of their own experience of the same, for example, a rare disease. If your loved one has a disease that no one in the support group is dealing with in your local group, you might be able to find one online and make a connection there. How are we doing? Okay, so I think it's important for caregivers to realize that along the caregiving spectrum, you need to work very hard to thrive in your role as a caregiver, and not just simply survive day to day. I think it easily becomes that it's a pitfall that people fall into. They begin to simply just get up in the morning, do whatever needs to be done for the next hour, the next afternoon, until they crash into bed exhausted at night, and they're barely surviving, they're barely holding on, things are starting to fall apart. I have a video that I'd like to play for you.
You expect me to take Mother wherever she wants to go. You just don't realize how busy I am.
You always complain about being so busy with your family. The truth is, you are lucky. You don't have to work, and I do.
The impact of the you message, how did that make, I'm sure my sister did not feel good when I was, accusing her of expecting me to do everything.
When we define a family caregiver, we define it pretty broadly. Caregiving can be done as in somebody lives in your home, or perhaps mom is in a care center an hour away. You still are a person helping to see that they are receiving the care they need, and that makes you a caregiver.
Okay, so what I'm writing is, I agree that you need to know about your finances. That's a good one, I think.
ISU Extension and Outreach has worked with the aging population off and on over the years, but the emerging issue that we have found a special niche for is that of working with the caregiver population. And so we have chosen to embrace the Powerful Tools for Caregivers national program. It's intended to help people develop skills and tools so that they can thrive in their role as a caregiver and not just survive it. So we want them to be able to have a good life, a happy life, and that in turn will make them a much better caregiver.
Jaylyn and I will demonstrate a conversation between a caregiver and a family member. Listen for how the word you is used in conversations. Ask yourself, how did I feel after hearing this conversation?
I think that the Powerful Tools for Caregivers is very powerful because it teaches you how to take care of yourself so you can take care of somebody else.
Being able to cover all of the things with both of my parents, learning how to communicate those needs in a positive way with my siblings has been very important to learn.
I don't get angry at my mom, I get frustrated because my mom has to go through this. It's okay to feel guilty, but also understand why you're feeling guilty and go beyond that.
I think one of the things that they have taught us and will be helpful to me in my caregiving life, but also in my family life, is just the communication, using an I message. I'm frustrated, I'm hurt. And there are times when I have to, talk to my sisters and explain what's happening, and they don't always understand because they're far away. And when I can impress upon them that I'm doing the best I can, with the situation, then I think that will help them and me also, and ultimately my mother, which is very important.
We now have over 80 people trained to deliver the program. It's in over a third of the counties, and we are growing very rapidly. And the people that we are training to deliver the program are volunteers in the communities. Some of them are professionals. Many of them have or are currently living the life of a caregiver, and they certainly all have a passion for what this means for families.
On the resources page, I listed it's under Iowa State University Extension. I listed the web address that you can go to, but if you do get a chance to look at it, it's an important resource as a caregiver because it offers classes online and face-to-face through the AIMS extension to help caregivers develop very specific tactics on how to manage being a caregiver. I believe it's 6 classes, and they have workbooks and lectures and lessons and things about being a caregiver and things that you can do to take care of yourself and your loved one. And there's the resources. So that's all I have. If anybody wanted to ask any questions, now would be the time. She has a microphone that she'll bring around. And if you do have any questions, it would be great if you could share with everyone kind of what your role is as a caregiver, so we can get an idea of, a little bit about who you take care of and maybe what you've been doing, what's been working for you as a caregiver, what you might need more help with, or if you just have a general question, that's fine too.
I am not currently a caregiver, but have been a caregiver, and I really relate to not wanting to give up or not even being able to think of how someone could help me. And I would appreciate some help on how do you even sort out when somebody says, "Can I help you?" How do you sort out in your own mind how others can help you?
Sure. I think that that's a great question because you're dealing with being overwhelmed, for one thing. I think if you can take the time to list out everything that needs to be done on a regular basis, so for household management, caregiving management, even your own personal priority management, you can kind of start to see what tasks, like for example, I really need these dogs to be walked every day. I need somebody to take care of my family's laundry once a week. If you have it concretely listed out, I think it helps for people to understand, what they're really dealing with, so it doesn't feel like it's just in a big cloud of hovering over them. It's on paper, but also they can start to cross off and put names by people that would be good at taking care of those tasks. Another thing to do is when people offer to help, what are you good at? What do you like to do? What do you think would be the most beneficial? A lot of times people say, "Oh, well, I love to cook. I'll bring you, a home cooked meal twice a week." Perfect. We'll take it. Do you have some ideas?
What Traci said and what I said before about having concrete tasks listed is incredibly important. So for me, when people wanted to do something, I hated to hand it over because I was afraid they would make decisions and then I would have to deal with their decisions afterward. And I think that's what a lot of people who are like me and maybe like you worry about. It's like, okay, you can clean my house, but I know you're not going to do my laundry the right way, so when I put my clothes on, they're not going to fit. If you can come up with tasks, well, you know what I mean. And we're all like that to some degree, and you don't want to make that, you can only get over so much, you can let some things go. So for me, prioritizing tasks that didn't matter a whole lot, that just about anybody could do, I really thought about it, and I gave people that thing to do. And again, being the way I am, I found that being honest and really open with everybody was the best thing. And they know me if they're coming to offer help and tell them, this is what I need and just this, bring it back and I'll be fine. And so I tried to delegate things that had nothing to do with, for example, touching my husband, cleaning him up, shaving him, things that were very personal care things because that's what mattered to him. So I thought about what mattered to him and what I could let go and kept it concrete, and that was the only way that I was able to give some of those things up. That helps. Mm-hmm.
I am one of 5 siblings trying to coordinate long-distance care for our father in Oklahoma. None of us even lives in the state, so that makes it even more difficult. His situation, which has been complicated, is even more complicated now because his second wife, who has been very controlling and very, very reluctant to relinquish any control, fell off a ladder and broke her hip. She also had a stroke while she was in the hospital. And so finally, we're getting some tangible power, but that means that there are more issues for us to deal with. And just as you were talking, we have kind of money has not been an issue so far with his care, but he is a veteran, and I'm just wondering, to get to my specific question, whether to access veteran benefits, he has to show financial need. Yes, he does.
Oh,
No.
That's Traci's.
No,
No.
he doesn't. He has to show his, what are they, the DD 214 papers?
Is that discharge papers?
So any paperwork that he has, does he not use his VA? Is he not affiliated
No.
with it at all?
No.
Oh,
Private care.
okay. So yes, the VA would be a very good resource for him. The caregiver support program here in Iowa City is not a unique thing. They do have them in other VAs.
Well, with all the press lately about VA services, medical services particularly, how do I know if the VA system in Oklahoma, and specifically where he is going to be one of those problematic ones?
Sure, that's a big concern, I can imagine. It wouldn't hurt for you to maybe contact the Iowa City VA. Connie Holmes, Holmes, is the Caregiver Support Program contact there. She would be able to answer more detailed questions about, not just the general program, but also ways to access care in Oklahoma since you're not there. She would be a really good contact for that, and she's a plethora of knowledge. So.
One other question, since I have the mic and I won't ask for it back again. Well, maybe. One thing that we've encountered, like back on the page where you list where to find respite care, I just have always assumed that not-for-profits were probably a better resource than for-profits. Is that, I noticed that you don't divide them out on your list.
No, they're alphabetical.
Are they what?
They're just alphabetical.
Yeah, okay. And I think, does either of you have an opinion about this issue?
I have an opinion. First, I don't think you can assume under any circumstances that nonprofit is necessarily better than for-profit. Yeah. I think we all get this idea that not-for-profit is so magnanimous and they're always really, really good people because they're not trying to make a profit. But I think we're forgetting that making a profit is not a bad thing. So I would caution you to not use that as a dividing line. But a really good resource to find someone that's good is Home Health Compare. That's a place to start. Might help you identify agencies, nursing agencies in that area that provide the kind of services you're looking for. Now again, he has VA. I don't know what his pay sources are, so I can't get real specific, but it's a starting point. They have a variety. Here in Iowa City also, there are agencies that provide Medicare certified services, which means they bill to Medicare and Medicaid, and they have to meet very stringent guidelines for the patient to qualify for services. And they provide private duty care, which means you can pay out of pocket. But if you're looking for a few hours a week, that is money very, very well spent. So that's a place to start. You can look for private duty or respite care, and there are respite services available under some state benefits, and I don't know anything about Oklahoma's system, but that's a place to start. Then you can look at how they rate as far as their quality for doing a number of things. So those are
rate according to whom?
CMS. So Medicare does the Center for Medicare and Medicaid Services. It's Medicare. It used to be called, I don't remember, but it's Medicare. Medicare provides these ratings and these comparisons. So you can go and put in the zip code, go to Home Health Compare, put in the zip code, and it will pull up home health agencies. So, but there's a
Is it only for home health?
It's only for home health, but it's a place to start. So if you look for people who provide certain kinds of services, it'll give you some phone numbers in the area, so you can start looking for someone with a recommendation as opposed to pulling up a list online or the yellow pages or something. So it's a starting point. And if you get people who are in your father's zip code, you may have to make 3 or 4 phone calls before you get to the right place. But that way you'll be getting recommendations from agencies that you know are good. And that Home Health Compare is an objective measurement of how well their patients get better at walking, get better at breathing, whether or not they're discharged into the community able to take care of themselves, whether or not they have preventable problems like falling repeatedly at home or getting dehydrated or malnutrition. So those are things that an agency is supposed to be there to prevent. And if the patients do well, that says they provide high quality care. So you can also, on that same website, look at satisfaction surveys, so you can see if the people they're taking care of think they're nice and they do a good job. So you can look at both of those things, the objective quality measurement that Medicare says they have, and the patient's perception of how well they do.
So could I just ask if you guys trust that?
I do trust it. I think if you went to, I look at it routinely because that's how I can see what our competition is doing, and I can see how we measure up against them. And so I go on there and look, and I can honestly tell you that what I see on there reflects my general opinion of the agencies that I'm looking at. Mm-hmm. And there are always outliers. And you'll hear about things that may be really exciting or dramatic or glamorous news because it makes people look at a news story, but it doesn't necessarily tell you everything. It may be a one-shot problem, and you don't want to cut something out because there was one small issue that really doesn't have a lot to do with the care that they provide. So I think it's a good overall picture of the quality of the agencies, and then your job is to follow up, talk with them, and you have to have a feel for the people you're talking to. If they feel like they just don't want to be talking to you, why would you want to deal with them on a daily basis? But if they are kind and they sound compassionate, they give you honest, direct answers to your questions, they're probably worth looking into.
I just had one more point on the caregiver support groups. I don't know if in your presentation, I didn't hear it, but there are support groups that are disease specific too.
Yeah, you can find, so online is a good way to go about that. You can find support groups that are disease specific or condition specific, even like locality. You could, for example, if you want to filter it out for like Oklahoma or Iowa, depending on who you want to go for, you can absolutely do that.
I was just thinking, I know that Deborah and I both attend the Alzheimer's support group, and so.
Yeah, that would be a common one, I think.
That's all.
Okay, thank you.
You definitely should go over to the VA hospital. My husband is a veteran, and you should go over there and find out what all they could help you with, because they're very compassionate.
Yeah, I've heard that the system here is really great. Mm-hmm.
I just want to add and put in, this is a little bit along the lines of what we were just talking about, is finding quality. It's been, like I said, some stories are really big and they're splashy because they make great headlines. So the issues, whatever they are with the VA system, I don't know and I can't tell you, and in my experience, they do provide excellent care to veterans, and they do way more good than harm. The problems that you've heard about have to do with access, and that's really all I know, but I want to caution you to make sure that when you hear those kinds of stories, take it with a grain of salt and find out for yourself if the services that you need and want are available, and then you can decide for yourself. Yeah.
So, my mother has had a stroke, and I've moved back here to be with her, and she has, it was very serious, and she's not able to walk or talk. And she's in a nursing home, and it's a really great nursing home. We're happy with her care there. But because she can't talk, I feel like I'm being her advocate, and I'm there a lot. And just wondering if you have any ideas about, well, I have a few questions, but perhaps volunteers that are able to come in and provide support or activities that help her to use her brain. She's very present and aware, but she can't speak.
Is she able to like write and like do fine motor skills?
She has some her use of her left hand, but writing isn't easy for her. I've been away most of the time that she's since then, and so there hasn't been anyone that's been able to help her work with that. But
sure. Well, one thing that kind of just popped into my head is having somebody come and read to her or with her, letting her listen to audiobooks if there isn't anyone available immediately. It would be better if somebody was with her for companionship. Doing things like playing cards, maybe things that she can like stimulate her brain without necessarily having to do physical fine motor actions. Would be really helpful for her. Do you have any?
The only other thing that I was going to say, and I apologize if I tend to get logistical about this, but if she's in a nursing home, you need the services that you can bring in and have paid for through Medicare or the insurance may be limited, so you need to look, because the nursing home is being billed, bills for a daily charge, and they're supposed to provide everything. And they do, even the best nursing homes do a great job, but you may feel that there's something else that she would benefit for, and it sounds like that's what you're saying. I would just encourage you to use the list of resources the same as you would in your home. So these are people who could come and sit with her and be companions. If she had a network of friends and family, or if she had a church that she belonged to before her stroke, those are all good resources to tap into, because not only would they be happy to help, but she would see a familiar face in those surroundings, and it would feel even more comfortable and warm for her if she saw those familiar faces.
We do that. Her church has been great in the sense of, and right now, 4 of them have volunteered to do some healing touch with her, and so they come on a regular basis, so we're really happy about that. But I don't want to tap out, I'm looking to branch out and find other kind of, and especially even people that can sit with her and maybe like do singing or speech stuff. I sing with her, things to help her not lose what little speech she does have. Right. Yeah. You
also can consider, people never consider this, or I shouldn't say never say never, but most people don't consider the fact that professional services are available even though insurance doesn't cover it. So if you have any resources, you can prioritize what you want, and you could pay for a couple visits a week from a professional therapist who does speech therapy or physical therapy or something, realizing that it's over and above what may be medically necessary for someone in someone's view, but it's just going to provide supplementary help for her. So, don't forget the fact that you can pay for those professional services if you choose to have more than is available. So that's something to think about.
And do you know of any stroke support groups?
Yes, Mercy Iowa City has a stroke support group. So if you go to the website, I can't tell you exactly what to click on, but there's community resources. There's a button for community resources, and do you know where to find that on the website?
I'm trying to think. So the website is mercyic.org. It's also on your resources page. I believe you can. There's a search bar. Once you get in there, you can type it in, and then I think on the left-hand side, it would be under either resources or support groups. I'm not sure which one, but the website itself is very easy to navigate. It's not overwhelming at all, so you could find it on there. And you can also always dial the Mercy, the direct line 339-0300, and they'll take you where you need to be.
Oh, that's a good idea. And finally, not finally, there's a lot of issues, but transportation, she is out of Johnson County, just over the line into Cedar, so that's been sort of an issue. Do you have any ideas?
Sure. So what kind of transportation are you needing specifically?
It would be mostly, I think, to medical appointments.
Okay.
Yeah.
So Elder Services is an agency that I contact on a regular basis for transportation. They have a program called RSVP. It's volunteer-based, and they are really great because not only do they pick up the client from their door, take them to their appointment, and wait with them, and then take them back. The other kicker for them is that it's all donation-based. So if you find yourself unable to pay, they tend to, the volunteer will often say something like, maybe an idea for paying for this service would be maybe cover the cost of gas, $5, whatever it may be. If you can't do that, it's no big deal. If you can do more, even better. But since it is a network of volunteers, of course, more donations always help because they're using their own vehicles and their own time. But there's definitely individuals who use it regularly and can't pay anything, and it's not an issue.
And so they are able to go outside of the Johnson County area? Oh, that's great. Thank you.
And it's also on your resource page, the contact info. Yeah.
And actually, I was wondering if you could put up your resource page again, because this got a little light, and so, great, thanks.
Yeah. I was just going to say, if anybody's interested, I can give you my card, and you can email me, and I can send you the whole PowerPoint if you want a whole color version.
You can't see the email addresses on this.
Is it light?
Very.
Okay. So if anybody's interested, I can just send it to you.
One of the things that you brought up was the certification of agencies and that kind of that oversight, outside oversight. And I think that's important to think about in terms of when you're looking for agencies or help. Both the level of care, do I need a nurse? Do I need an aide? Do I need a volunteer? What level of care, and the certification or the hoops that oversight that is there. Do you have specific questions that maybe when you're calling agencies you can ask?
I do.
Okay, good.
So the first thing I would ask is, are you Medicare certified, which means they're qualified to bill Medicare and Medicaid because they participate, and they participate in all the conditions that you have to bill to Medicare, which means that Medicare oversees them. So there's that oversight. In Iowa, the Department of Inspections and Appeals surveys nursing agencies every 3 years. They show up when they want, at their will. So you know that if they're Medicare certified, someone's been in there from the state to survey them. You can also ask if they're Joint Commission accredited, which is another level of security and safety. That is another separate, it's a private organization that has been tasked by Medicare to survey healthcare agencies, and so Mercy is Joint Commission accredited. It's just one more level of quality that you can ask for. So those are two questions that I would definitely ask. And they should know the answers to those immediately. And as I said, it doesn't guarantee everything, but it does give you some peace of mind that there are other people looking at what they do on a routine basis, not only paperwork and office stuff, but out there in the field to see how they treat people, which is important. And, we talked about private, not-for-profit versus for-profit. They both qualify for all of those certifications and accreditations. So the most important thing is that there's some oversight, some agency oversight that happens, so that someone is coming in and looking at what they do. That's a very important point. Thanks, Maggie. Did you have anything else to add to that?
No, the only thing I would think of is something that I hadn't thought of when I was a caregiver was that level of care. Do I need a nurse with my mom overnight, or how do you know that?
Yeah, that's a good point. So a home health agency that has multiple disciplines, nurses, therapists, and home health aides, will go in and have one of the professionals, a therapist or nurse, evaluate the patient to look at what their care needs are. And they'll first identify whether or not they can be taken care of in their home, someone that they can meet the goals of care. And then two, they can decide if the person needs more help than is available in the home, or if they can meet those needs. So, and even if someone, even if we would go out to see someone with Medicare, they're not homebound for some reason, we can't admit them under Medicare if they don't want to pay privately. We'll go out to do the visit, and we can certainly give you a recommendation about what their care needs are. Even if they're not homebound, doesn't necessarily tell you everything about their ability to care for themselves or care for themselves in their home. So there's always the opportunity for the agency to come do a visit and make an assessment, and they can tell you what's necessary and what isn't. And then they'll work with the family to see what, or the caregivers to see what their level of ability and desire is to be in the home and how many hours, and work with them and give recommendations based on that.
Great, that's helpful to have an outside source come in and help with that assessment. That's great.
Any other questions?
Thank you very much.
Thank you for having us. Yeah.
Thank you.